All right, today we're talking about something called urodynamic testing. It sounds kind of technical, right? But trust me, if you or someone you know has been dealing with some, let's say, frustrating urinary issues, this is going to be super helpful. We're going to break it all down. You know what I'm talking about, right? That little leak when you laugh too hard. Or maybe you're the person who knows the location of every single restroom in a 5-mile radius. It can totally run your life, but you're not alone. Figuring out why it's happening, well, that's everything. It's the first step to getting things back on track. And that's exactly where urodynamic testing comes into play. Think of it like a high-tech peek under the hood. It's a series of tests that gives doctors a super detailed look at how your whole urinary system is actually working, so they can finally get to the bottom of things. So what is it really? Well, it's not just one test. It's more like a whole suite of tests. And their job is to check out how well your bladder, your sphincters, those are the little muscles that act like valves, and your urethra are all playing on the same team. I love this analogy. Think of it as a performance review for your bladder. Is it doing its job right? Okay, so first things first. Why would your doctor even bring this up? What's the point? Well, it almost always boils down to one thing: getting to the root cause of what you're experiencing. Just take a look at this list here: leaking, going all the time, that sudden I gotta go now feeling, trouble starting. You get the idea. If any of these are hitting close to home for you, well, these tests are designed to figure out exactly what's going on behind the scenes. And that's the key, right? The goal isn't just to slap a Band-Aid on the symptoms, it's to really understand the mechanics of what's happening. Is it a muscle thing? Are the nerve signals getting crossed? Is something blocked? This testing gives your doctor the actual data they need to stop guessing and make a real diagnosis. So, how do they get all this amazing data? Good question. Let's dive into the tests themselves and see what each one is actually measuring. This table is a perfect cheat sheet. Think of it like 3 main pieces of a puzzle. You've got uroflowmetry, that's all about speed and volume, then cystometry, which is about pressure inside the bladder, and finally, electromyography, or EMG, which checks if the brain and bladder are, communicating properly. Each one gives your doctor a totally different but super important clue. All right, let's start with the easiest one of the bunch, uroflowmetry. Like we just said, this one's all about how fast and how much you go. And the procedure could not be simpler. Seriously, you just show up with a full bladder and pee into a special toilet or funnel. That's it. It's totally private, non-invasive at all. A little computer measures everything and spits out a graph for your doctor. It shows them if your flow is nice and strong or if maybe something's getting in the way. Okay, next up we're going a little deeper with the cystometric test. This one's all about measuring the pressure inside your bladder as it fills. So this one is a bit more involved, but the information it gives your doctor is just golden. They use a tiny, super thin tube, a catheter, to measure that pressure. They'll gently fill your bladder with some warm, sterile water. And as they do, they'll ask you things like, okay, how full does that feel? They're checking how much your bladder can hold when you feel that urge to go, and, really importantly, if you leak a little when you do something like cough or bear down. Now, something that's often done at the same time is called a post-void residual measurement. Big words, simple idea. It just means how much pee is left in your bladder after you go. They can check this with a quick, totally painless ultrasound, or sometimes they'll just use that same little catheter to see what's left behind. And this is a big deal. Why? Because while leaving a tiny bit behind is no biggie, leaving more than, say, 150 milliliters, that's about 2/3 of a coffee mug, that's a red flag. It tells your doctor your bladder isn't emptying all the way. And that leftover urine can cause problems, like recurring infections. It's a huge clue that there could be a blockage or that the bladder muscle just isn't squeezing hard enough. Okay, so we've talked about the what and the why. Let's get down to brass tacks. What's the day of the test actually like? I think knowing what to expect really helps take the anxiety down a notch. It's a pretty straightforward journey, really. For prep, they'll probably just ask you to come in with a full bladder. The whole testing process itself, usually only about 30 to 45 minutes. And afterwards, you might feel a little bit of discomfort, but it's usually super mild and gone within a day. I know the number one question on everyone's mind is probably, does it hurt? And look, this quote from the Cleveland Clinic says it all. These tests shouldn't be painful. You might be a little sore for a bit, yeah, but we're not talking about severe pain at all. And this is your game plan for after the test. On one side, you've got the what-to-do stuff. Simple things like drinking lots of water and maybe taking a warm bath to feel better. And on the other side, super important, is when to call your doctor. Things like a fever or bad pain, you definitely want to give them a ring. And just to be super clear, these tests are very, very safe. The risk of a serious problem is extremely low. The main thing they watch out for is a small risk of a urinary tract infection from the catheter, and sometimes your doctor will give you an antibiotic beforehand just to be on the safe side.
Okay, we've made it through the prep and the procedure. Now we get to the whole point of it all, the results.
This is it. This is the payoff. All that data we collected, the flow, the pressure, the nerve signals, it all comes together to create a crystal clear picture for your doctor. It lets them design a treatment plan that is tailor-made just for you. And the good news is you're not left waiting for weeks. For some of the simpler tests, you might get the results right away. For the more complex stuff that needs a closer look, it might be a few days, but it's pretty quick. And really, that's the bottom line, isn't it? The whole reason to do any of this is to get you closer to feeling better. It's about trading in all that I don't know what's wrong uncertainty for some clear, solid answers you can actually do something about.
So if this is something you've been going through, try to think of it this way. It's not just some annoying test you have to get through. It's actually the first real, concrete step toward understanding what's going on and, more importantly, finding a solution. So the real question is, what are your results going to reveal?